Gusto niyo pa magpa-physical therapy pero walang oras o kakayanang pumunta sa ospital? Gustong umiwas sa banta ng COVID-19 at iba pang mga sakit? O mas komportable sa sarili ninyong bahay? Para sa inyo ang kakayanan dalaw service. Pagkatapos magkasundo sa schedule, pupuntahan kayo ng aming physical therapist sa inyong bahay. Makakasiguro kayong private transportation ng aming gagamitin upang makaiwas sa exposure sa ibang tao. Profesional, lisensyado, at experienced PTs ang makikilala ninyo. Mag-message lang dito o pumunta sa kakayanan.org para makapag-book ng appointment.
Doon po tayo hakbang sa close to the edge. So, Ate Joan, mauna kayo. Tapos kamay mo, Ate Joan, nakaganito kayo. Nakakamay. Yan. Alright, good. Would you want to share with us your experience doing online physical therapy in the last 10 months?
I started thinking about taking therapy with you again because I was worried because of the pandemic. I'm supposed not to go out of the house. So I don't know what to do now because I have to be in prison in the house. You cannot go out. When you suggested that I take online exercises, I said I just had to do it. I think it's better because you, as my therapist, would program exercises that would address my concerns. It's great, Josh. I really felt the difference before and after the exercises. I noticed I have gained my strength and my flexibility. I could balance myself better. After the exercises, I noticed I could easily lift my legs and bend my knees. And it's so different. I can walk faster and I can walk with confidence going up the stairs because you taught me how to do it the right way. So now I could go up and down my bed faster and easily, and I'm not afraid of falling down or falling off the bed.
Pag-angat po ng paa, sabay. Sabay ng pagbaba. Okay?
Sabay ng pababa.
Kasi
okay.
pag binuhat niyo po, may masakit sa likod. Okay, so try nating sabay. Okay?
Sabay, okay.
Ready? 1, 2. Ulit po.
Ulit.
Apa. So, yan. 1, 2. Yun. Almost. Sige. And then facing up. Good. Okay.
That's right, Josh. Thank you very much for helping me. Maybe I can invite my senior friends who have also exercises online. I bet you they won't regret it.
Well, there we go.
Nanginahanglan ba ka og serbisyo sa online physical therapy session o telehealth? Pero galisod ka sa imuhang budget? Diri sa kakayanan, adunay nagkalain-laing packages na ginahatag aron pagpilian base sa imong budget. Pwede nimo pilion ang tunso packages na nagahatag og video call therapy session. Pwede po nimo pilion ang tambuli packages na nagahatag og follow-up sa physical therapy session pinaagi sa pagtawag o pagmensahe. Bisitaha lang ang kakayanan.org para sa dugang na mga impormasyon o detalye.
PT Josh and Nobel today. And hi, good morning, everyone. This is Dr. Joff. I am Dr. Jonathan Flordelis, and thank you so much for inviting me today. We actually have something really special for you. If you saw yung exercise na tinuro po ni Sir Josh. This is something that I'm really excited to share everyone and all of my viewers and followers, because Mr. Josh Manoharan is a physical therapist based in Bonifacio Global City, Taguig. Finished his bachelor's degree in the UP Manila 2013. He started with Physio Asia in Singapore. Then he did F45 training, served as the gym's head coach for 6 years. He currently holds clinic at Kerry Sports Manila, Shangri-La at the Fort. He focuses on managing sports and musculoskeletal injuries. But during the pandemic, when there was no face-to-face, he actually pioneered tele-rehab, the Kakayanan Digital Rehab Inc., a home care and startup company aiming to bring online physical therapy services to all the Filipinos. And Josh's aim is to share science-based evidence to improve the quality of life of Filipinos around the world. And that means you guys who are suffering from arthritis, if you have difficulty moving around, let's welcome Josh Manoharan. He's going to share with us the top 5 exercises so that you can warm up your joints and get moving. So, big round of applause for Mr. Josh.
Good morning, Doc. Good morning to everyone. Magandang umaga po sa lahat. May buntag sa tanan. So, we're very excited to share with you some very simple exercises that everyone can do. Okay, so regardless if you are on a wheelchair or if you're able to stand, if you are currently having arthritis, this 5 to 10 minute exercise session would be very beneficial for all of you. So allow me to walk you through our exercises. So please follow everyone na lang. Ha? So whether you're on a chair right now, you can do this. Let's begin. So let me just
really
add
excited.
on a little bit of a little bit of music para meron may ambient. Okay, let's start. Can you see and hear me clearly, everyone?
Yeah, I can hear you, Josh. We're about to follow your exercises. Everyone,
On your lap for now, let's start with some neck movements. Head down,
down,
head
neck
up,
down, neck up,
head down, yeah, side,
down,
up,
neck up,
last one, down,
last one down,
and up.
and up.
Good. Next, side to side,
Side to side,
side,
side, side,
last one,
last one,
very good. After that, rotations, looking at your shoulder, side to side,
your shoulder, okay. Look, your shoulder,
last one. Good. All right. So for your neck, we only do 3 times so that we don't need.
okay.
Next, we'll start with our first stretch. So we're going to stretch your upper traps muscle. This one.
So, okay.
One hand. This muscle. So you put one hand on your lower back.
One hand on your lower back
And pull your head sideways.
and pull your head sideways. Okay.
We'll count 30 seconds.
30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 4, 5, 6, 7,
All right. Good. Other side.
we're gonna do the other side, okay, Josh? So, hand on the back, pull your head towards the other side. 4, everything. 88, 90, 1, 4, 5, 6, 27, 28.
Great. Okay.
Alright.
So on your own, you can do 3 times of that. Pero for us now, because we don't have a lot of time, we'll just do 1.
Okay. Okay, so
That will really
but ideally we will do 3 sets according to Josh. Thanks so much, Josh.
Yes. All right. Next, we'll do our next one, which is arm rotation. Okay.
Arm
So,
rotation. Okay, how do we do that?
Shoulder circles.
Oh, shoulder circles. Okay.
Arm rotation.
Oh yeah, this is going to be very, very nice for those who have stiff shoulders.
Yes.
Para sa inyo po na parang matigas yung balikat, no? Early in the morning. I think this exercise might be very helpful po sa inyo. How many are we doing? Ulit, Josh?
Fine. Last one.
Last one. Okay.
Then other way around.
Other way around. Balik ka na. Maharap naman. Okay.
Five, 6. Especially for those who are, wheeling, on their wheelchair all the time, their hands are barely moving.
Oo nga, no? Pag nasa wheelchair.
So we start with the shoulder, then you go down to the elbows. That's the rotation. Elbow rotation.
Elbow rotation. Okay, let's do the elbow rotation. Okay.
Good. Very simple.
There is
So this is good to lubricate the joints, no? There have to be fluids inside. And reverse, other way.
It's the other way. Lubricating the joint.
So it has to move, so it has to be the elbow moving. Okay, so we started with the shoulder, then the elbow, then the wrist.
Elbow or wrists. Okay, now we're doing wrists.
4, 5. Actually, lately we're always on our gadgets, cell phones, so typing on your laptop, holding the remote. Oh, don't be surprised pag nasakit yung wrist. Other way, reverse.
Okay. Thanks so much, Josh. So if you are on your cell phone or your laptops or your gadgets all the time, this is a very nice exercise to loosen up the joint.
It relieves the tension on the nerves also. Sometimes our nerves get compressed because of all that. Alright, so our wrists and the body are warm. How are you so far, Doc Joe? Able to follow?
I think we're doing well, and thank you so much to Mr. Edgar Parton for comments and good morning. Although the followers
So my mother, my number one supporter, si Mama Elsie Bubachi. Okay. Let's do our stretch for your upper body. So 30 seconds also.
30
Start
seconds.
by
Okay, we're gonna do a stretch.
fingers together.
Okay, this is the upper body stretch for the fingers.
Oh. 30 seconds also.
30 seconds. Even if you're on a wheelchair, even if you have severe arthritis, you can do this exercise at home. Thanks so much to Sir Josh. And you can reach him at kakayanan.ph. That is his Facebook page.
Alright, now we go upward. Upward stretch. Right? So stretch your back, your chest, stretch your back. Oh. Shoulders.
You need to force yourself to stretch it out.
Five, 3, 2, 1. Now we bend to one side. This is to stretch
To one side. Okay.
muscles on one side. Feel it here, but
Oo nga, nasa-feel ko dito yung stretch.
so don't
Yeah. Good stretch.
very simple lang, no? We barely use any equipment here. But you can release your body tension. Good other side.
Other side, stretch. Now we're stretching this other side. That's
You feel it, though? Side of your body.
yeah. After yung Spartan, mukhang tight pala ako.
Oh, nga pala, you just finished your race.
Yeah.
Congrats. Okay. And relax.
Alright. Thank you so much, Josh. What is the best
Inhale,
feeling?
exhale.
Yeah.
Inhale, exhale tayo 3 times.
Inhale. Exhale. Inhale. Exhale.
Inhale. Last one.
Inhale.
Right. Good. We'll move to our lower body.
Oh, lower body na. Oo nga.
So, we have a very simple exercise, but we need a towel or a pillow. Whatever you have.
Oh, kung hindi na tawag, gawa mo na ako ng tuwalya pala.
Okay, we'll get a towel or a pillow for those who are get a small one or anything you can squeeze. Anything you can squeeze.
Okay, I got my towel na, Josh. So,
Yeah,
everyone,
so-
Josh, recommend that you have a towel or a pillow, no?
Yes,
Ano
so
yung
you can
gagawin?
release.
Okay, you fold the pillow.
If you want, my pillow is not too fluffy, so I fold it. But
Okay,
your
pillow
call. As
or the
long as
towel.
you just feel the tension.
So iipit ano? Yun lang. So, yeah, okay. So I'm gonna show them. So, you have a pillow or towel, ipitin yung pillow or towel, ipitin yung legs. So, pasensya na po, naka-perch na po ako.
Okay, ako na lang, Doc. It's fine. Ako na lang. Okay. So,
yun.
we will push it together and we will count for 7 seconds. And then you push. 1, 2,
2, 3, 4, 5.
Alright, round 1. We'll do 10 times, round 1. Push round 4, 5,
Hindi ka na naman. 1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah.
11, 16. 4, 5, 6, 4. Okay, maybe we can only do 5. Since it's the first time. 3, 4, 5. Alright, 5 times. Okay. Where did you feel it, Doc? Where did you feel it?
I think I felt the muscles in my groin, no, sa my singit area, nag-contract sa my singit na muscles. And I hope you guys at home are feeling that, no? So we want to exercise the lower body. Josh is starting us with the towel
Exactly.
exercise.
That's a very safe exercise. That's called muscle setting. So for those who have hip replacement, that's very safe. There's no harm.
Very good for hip replacements, no, and bagong opera safe. Thank you so much, Josh.
So the 7 seconds, I just want to say that it's to maximize your muscle contraction. It takes 7 seconds to warm up the whole muscle. That's why we're counting. And then when we're counting, make sure you breathe out, not holding your breath.
Oh, so we need to breathe while contracting. Tama.
Yeah. All right, we're halfway through our exercise session. Next,
Okay.
we'll be marching. Seated marching.
Marching. Okay, so marching. So we're gonna do marching. For those na naka-wheelchair, Josh, they can march in place, no, while sitting down.
So pwede pa
Okay,
seated.
Seated marches pala to. Seated marches. So para sa inyo na naka-seated marches.
So, careful lang for those who had hip replacement kasi bawal sila mag-increase So, ano lang, you need to be careful.
Okay. For those who have hip replacement, be careful lang po kasi may mga bawal like your like of course not for everyone. But and 30, okay, 30 seconds. If hindi bawal sa kanila yung seated marches, pwede nakatayo sila marching place, Josh, no? Or yung walker.
Next, we'll do the extension of hips. We're going to take your leg.
Okay.
Okay, let's go. That's all.
Okay, so we're gonna extend the hip and that. Extend ka na ulit na wala akong first lahat.
Alright, okay.
And keeping the knee straight forward. Last go.
You can adjust the difficulty level. Work within a range that doesn't hurt. Okay, it shouldn't cause pain. All of these movements, this should not be causing any kind of pain.
Okay. Thanks so much, Josh.
Last, kaya ba? Standing. So for those who are using,
kaya pa.
pinawisan na si Doctor. Okay, yun na yan for blood circulation.
Oo nga, nagpa-flow na yung blood, ano? Warm up na.
Yeah. For those who can stand, do this with me. Okay? So for those who are using a walker or a cane, you'll benefit a lot.
Okay, so para sa mga kayang tumayo, if you can stand with us, no? Pag may walker, you can walk down like this, holding on the walker.
Yeah. So I will be using my chair. Kunyari, yan yung walker ko. Okay? I can hold on. The first one is standing. Yeah.
Okay.
So this will wake up the stabilizer. Okay, the side muscle. You keep your balance.
Balance, we're using the glutes. And we're just doing a little side step movement with Josh. No? Correct. Josh, side step movement.
Side step, correct.
Like a side to side movement. And this is for the gluteus medius, for the balance.
Perfect. Now we'll do the other side as well.
May speed ba dapat yun? Mabagal na yun, hindi naman mabilis.
Slow lang.
Yeah, so that's first side step motion really slowly. Just so that you can muscle movement. Last one.
So we're keeping it 10 on you, so it's easy to remember. Hindi lang maalala.
Okay. Very nice.
If for those
Move side to side, move the forward and backward movement with your walker, with your cane.
next, for those who have good balance, you can keep sideways. Okay, so you're going to put weight on one leg, hold on your walker, and then go sideways.
Okay. So this is the one leg balancing.
Yes.
Just put weight on one leg, tapos mo balance. Okay, put it the other leg. First, start with right, then the left. 10 seconds, Josh.
Repetition natin. So 10 times.
10 times. We repeat the balancing with one leg 10 times. Okay.
So this leg is keeping your balance, the other leg is keeping, you're working it together. Both sides.
Okay, so we're just using, paano ba to? One leg.
Alright. Where did you feel it, Doc?
Okay, I feel it dito sa hips, no? Sa
Perfect.
upper thigh. I feel the burn.
Lapit na ha. Okay. Knee bending. This is naman for the hamstring, right? A lot of people have difficulty walking because they can't bend your knee so yung walking is like that.
Oo nga, no? So lalakad sila na parang paika-ika. It's because weak yung muscle.
Especially pag arthritis, kaya namin sa maglakad. So,
Arthritis, like you're walking parang ganito. Tama.
so we can strengthen your hamstrings with that.
So we're gonna strengthen all these muscles para mababalik yung balance and we're doing this exercise with lifting the hamstring exercise. Doing that, but again, this is a balance exercise. Gosh.
Yes. Right. Other side.
The other side.
You should feel that the back of your leg is big.
Mapipit ko sa yung hamstring here, no?
Yeah. Okay, a word of caution lang, no? For those who will do this, make sure you're allowed to put weight on your leg. Kasi hindi pwede, yung balance, diba? Your knee might knock it.
Yeah. So be very careful. Thanks so much to Josh. Again, you can find Josh at kakayanan.ph. That's his Facebook page. And he also has a website of the same name. Thanks so much, Josh. And that was a quick warm-up for all of you out there. Mga tinatawag natin na arthritis warriors, those patients with knee or hip arthritis. Today is all about health and fitness for arthritis. And our friend Josh just helped us do a morning routine that you can do even if you're in the wheelchair, no? And now that we're done, a lot of the patients, a lot of people out there, arthritis warriors, they are asking me, ano bang pwedeng kainin? Ano bang pwedeng kainin? Well, it's really amazing that we have a very important person in the form of Mabel Aban. Mabel Aban, she is a nurse, she is a nutritionist, dietitian, and a certified personal trainer. She has her own Spotify podcast, What Diet. She's into nutrition and fitness. She's the co-founder of Shape Medical Fitness and Nutrition Clinic in Quezon City, Manila. She's also co-chair of Sports and Nutrition Wellness Practice Group. Her clinic is in the Mega Clinic in Mandaluyong, Carol T Clinics in Metro Manila, and in Health Link Innovations, Marikina. And again, she's a certified sports nutrition specialist. She's also special in the American College of Sports Medicine, Philippine Association for the Study of Overweight and Obese. Maraming mga, kahit ako, overweight ako eh. Kailangan ko si Mabel. And she's a education of Bachelor of Science in Nutrition from the University of Philippines. Please welcome Ma'am Mabel Aban, who is going to talk to us about diet, about nutrition, and all these new things popping up, the probiotics and prebiotics, those things that I don't really understand fully. Hello, good morning, Mabel.
Hello, good morning, Doc. Ayan, so thank you for that kind introduction. Alam niyo, palagi ko talagang ine-emphasize yung gut health whenever I talk to patients with arthritis. Dahil may connection ang gut sa mga inflammatory processes na nakakaapekto sa pag-manage ng mga health conditions na ito. Kaya importante yung tamang diet. Kasama na dyan yung pagkocontrol sa amounts. So the amounts have to be individually appropriate at kung kailangang mag-lose ng weight, and most of the time, ito yung case, pag overweight and obese, nakakatulong din to sa management ng mga gantong conditions. But definitely, kailangang mag-modify din at i-improve din yung quality ng nutrition by being mindful of the food choices. Kasi yung mga day-to-day decisions natin about what to eat will affect then the lining of the gut at saka yung microbiome balance. Kaya nga na-mention mo, Doc, yung diba? Yung probiotics. So, of course, pwedeng manggaling to sa supplements, pwede rin namang manggaling sa natural food items. So, today, okay lang ba ituloy ko na, Doc? I-discuss ko yung top 5 tips on what to add.
Tips. Yeah, really excited because Mabel is going to give you the bite-sized tips that you can bring home today and her top 5 tips for choosing the food that you can bring home from the market, no? Paano kayo pipili? So Mabel, take it away. Ano yung top 5 tips mo para sa audience natin? What can they bring home for this arthritis warriors natin?
Okay, so unang-una, na-mention nyo na, Doc, yung probiotics, that's number 1. So pwedeng manggaling yan. Ang pinaka-popular source yan na natural ay yung yogurt. But make sure that you
okay.
pick the plain ones, yung plain Greek yogurt. Tapos sa likod, tingnan nyo rin yung sugar content.
Okay.
Dahil importante na yung sugar content is close to or less than 5 grams of serving. 5 grams per serving. Dahil minsan may epekto rin pag napakarami mong sugar na may negative effect if you consume a lot of sugar in the process of consuming probiotics. So kailangan mababa yung sugar content nung
yogurt should be low,
yogurt na bibilin nyo. So that's one. But of course, it's also in a lot of fermented products like kefir, kombucha. Pwede rin naman na manggaling sa iba pang mga fermented vegetables. So yun yung mga natural sources ng
yung kimchi ba fermented yun?
Alin? Kimchi, yes, kimchi.
Yeah, so
pwede rin yun. So those are some of the sources. Of course, minsan minomodify ko rin yung source ng yogurt. Pwedeng dairy or non-dairy. Merong coconut yogurt. Kasi some are intolerant to dairies.
Wow,
so yun din yung kailangan i-consider.
Thanks so much. Yeah,
ayun, so kung sensitive ka to dairies, tapos exposed ka rin naman to dairies sa pagkain ng yogurt, baka hindi rin maging maganda yung epekto sa gut health. So you should also be mindful of your food sensitivities. Now, so that's number 1, probiotics. Number 2, yung prebiotics. Yung kinakain ng good bacteria, prebiotics.
Yung kinakain ng pre-bacteria, good bacteria ay tawag ay pre.
So,
prebiotics.
Yes, so that's prebiotics.
For those listening, iba po yung probiotics at iba din yung prebiotics. Sabi ni Mabel, yung prebiotics po, yung kinakain yung pre, yung pro naman, yun yung bacteria, yung may bacteria, tama ba Mabel? Yun yung may bacteria mismo.
Yes, yun yung mga good bacteria mismo, mga health-promoting bacteria in our gut. Kasi sa gut natin, sa loob ng katawan yan, kung saan ina-absorb yung nutrients, yung intestines, para tayong may mga nakahouse na iba-ibang mga grupo. Sinasabi nga, there are trillions of microorganisms in our gut. So inaalagaan natin yung tamang balanse, and at the same time, we're also taking care of the lining of the gut. At ayaw natin na dun sa parte na yun, doon magsisimula yung inflammation that can also affect our musculoskeletal health.
Okay, so we need to feed the good bacteria. Yun po yung number 2, prebiotics.
Yes.
So please, sorry, I have to cut you off.
Right, that's why it's important to consume fiber-rich food items. So,
fiber-rich. Ano po ba yung fiber-rich para sa audience natin na di alam ano yung totoong source ng fiber? Or tama, ano yung tama?
Yes, so pwedeng manggaling yan sa mga high-fiber grains like brown rice, pwedeng oatmeal, pero yung rolled oats, hindi yung instant, hindi yung quick cooking.
Hindi po yung instant. Very important pala, hindi instant. Ang dami naming instant.
Oo. Kasi mas mababa yung fiber content noon. Hindi na natin nakukuha yung optimal amounts of fiber.
Rolled oats, not instant oats. Brown rice. Ano pa, Mabel?
Brown rice. Tapos yung iba pang mga, pwede rin naman sa mga root vegetables like potatoes, sweet potatoes with the skin dahil nandun yung fiber.
Yung skin, kailangan may balat ng potatoes, hindi...
Yes. Of course, you have to rinse it well para siguradong safe yung kinakain natin. And then, pwede rin naman yung iba pang mga grains like, adlay is locally grown pero hindi siya masyadong ka-popular as rice. Na-try niyo na ba yun, Doc?
Hindi ako familiar sa adlay, but for those of you, note that adlay, baka alam niyo kung ano yung adlay, please comment below.
Medyo, mas mababa yung carbs, mas mababa ng konti yung calories, pero nakakabusog and it's high in fiber.
High fiber na rice yan, yung adlay. I will do my research.
To rice. Ayan.
Hindi
So
ko
those
alam
are
ano
some
yun.
examples. But of course, fruits and vegetables, magandang i-add sa diet. These are also additional sources of fiber. Pwedeng manggaling din yung fiber sa seeds, yung whole
Sa seeds.
form ng seeds. Halimbawa, mga flaxseed, chia, at nakakakuha
Chia
din tayo
seeds,
ng
flax
additional sources ng healthy fats, omega-3.
healthy fats. So fiber and healthy fats all are prebiotics. Dami nun. I hope that somehow you can reach out to Mabel. Again, she is in FB and IG po. Ang name niya at Mabel Aban. That's one word. Mabel is LLEABAN. Mabel Aban. Reach out to her. Ask for her list of good, number 1, probiotics, and number 2, prebiotics po.
Okay. And can I add 3 more para maganda lang ma-mention that other vitamins and minerals are also important. Phytonutrients like vitamins A, C, E, nagagaling din yan sa fruits and vegetables. Vitamin E, nagagaling sa almonds, avocado oil. Tapos, isa pang additional tip, bone broth. Ito, maganda for musculoskeletal health and for the gut health because of the amino acids, glutamine, na na-extract from 24-hour bone broth. Ito yung matagal na pinakuluan. Slow cook dapat. Yung iba nga,
Parang yung
72
pochero,
hours.
yung ba yun? Pochero, hindi.
Parang,
Iba pa yung pochero.
in a way, minsan gumagamit ng bone broth sa mga ganong dishes, syempre sa bulalo, pero tinitrim din or tinatanggal yung excess fats.
Tinatanggal yung excess fats.
At
Tapos,
dapat mas matagal pa yung pakulo. Well, a minimum of 24 hours.
24-hour bone broth po, very good for your gut. Sabi din ni Mabel, if di nyo nakuha yung almonds and, tama ba, walnuts, avocado,
Mga healthy nuts, yes.
healthy
And
nuts.
then, may
yung
mga
AC,
anti-inflammatory, din, Doc, effect ang, yung mga natural teas, like green tea, turmeric tea. May
green tea po,
phytonutrients doon na maganda rin for the gut.
turmeric tea. So all these are grouped into yung supplement category na pwede nating bilhin sa supermarket or sa palengke. Healthy nuts, almond, walnut, avocado, yung mga, of course, bone broth, kayo po yung gagawa atan. Hindi yun basta-basta makuha lang sa supermarket in 24 hours. Tama ba? Meron po ba? Meron po bang 24-hour bone broth?
I'm not sure. I'm sure there are sources as well in
Kailangan-
Cebu, pero dito sa Manila may mga local suppliers din na gumagawa na ng
meron.
24-hour bone broth.
Meron
Kasi nga
po
matagal
pala
gawin.
24-hour bone broth available in Manila in some stores po. At saka yung yung mga vitamin A, C, E, baka pwedeng kunin sa, tama ba, pharmacy? Or
Pwede rin naman na kung hindi nyo talaga makuha from natural sources, from vegetables and fruits,
vegetables and
hindi
fruits,
masyadong
baka-
balanse pa yung diet nyo, supplementation is an option. But of course, consult your doctors and nutritionist dietitians first para mas maganda kung well-guided yung mga patients natin sa pagsa-supplement and mas somehow customized.
Yeah, so thanks so much. Ang daming information, no? Sa
Right.
sa instant oats pa lang nawala na ako sa instant oats, bawal pala 'yun. Dapat roll oats.
Parang too much. Ang daming kailangan i-absorb, no? At saka din pala, Doc, dadagdag ko lang na syempre, iwasan din natin yung mga simple sugars and processed food items. At isa pa, yung yung way natin ng pagkain, sana mabagal. It's also a way of taking care of our gut. Pag mabilis kumain, nakakarating yung undigested protein sa intestine, sa gut, and somehow, unti-unti nakaka-damage yun ng lining ng gut. So, slow eating pace also helps.
Okay, so keep that in mind, mga kapatid, mga arthritis warriors. Slow eating, mindful eating really helps. Tapos, yung sinasabi ni Mama Bell na simple sugars. Mabel, ano po ba yung simple sugars? Example, para alam nila ano yung simple sugars na nasa everyday life. Baka hindi nila alam ano yun.
Ayan, at ito yung mga matataas yung sugar content. So it can be in beverages, yung mga mahihilig sa soft drinks, artificial juices,
Bawal sana. Soft drinks,
milk
ano pa,
tea,
Mabel?
frap,
Milk tea, ouch, milk tea,
iced
frap.
tea.
Iced tea.
Tapos, Yung iba mahilig sa desserts, halimbawa halo-halo-halo, ice cream,
Halo-halo, ice cream.
mga mahilig sa chocolates at excessive yung intake ng mga sweets, chocolates. Of course, pag sinabing simple sugars, ito rin yung dinadagdag nating asukal to the beverages that we consume. So it can be in coffee, iba controlled, pero kung uminom ng coffee 5 times a day, so ang dami rin nako-consume
So yung
na sugar in the process.
sugar. Okay, thanks so much, no? So mga arthritis warriors, alam niyo po, simple sugars, yun sana wag natin idagdag yung mga white sugar or brown sugar sa mga coffee. If you already have inflammation, baka ito'y lalala, no? It can worsen the inflammation sa gut and sa joints niyo po. Thanks so much, Mabel. So we are now at tip number 4. Tama po ba?
So, ayun yung dinagdag ko. Yung tip number 4 is about slow and mindful
Mindful
eating.
eating, okay.
Tapos yung number 5 ay yung
Number
pag-iwas
5.
sa sugar and yung mga processed food items. So, ang process naman, ito yung mga anything that's preserved. Yung mga preservatives kasi are really some of them are not natural, made from chemicals na unti-unting nakaka-compromise din ng gut health. So, ito yung mga frozen products, frozen meats, canned, bottled, preserved in any way, dried. So, yun yung mga kailangan nating kontrolin or mas maganda kung may iwasan.
Iwasan sana, no? So, thanks so much. Those are the top 5 tips. So, for choosing your food po sa supermarket from our friend Mabel Aban. Again, you can reach out to her on Facebook and Instagram at Mabel Aban. And she has her own Spotify podcast, What Diet. And thank you so much, Mabel. What is your takeaway for our audience po bago tayo punta sa question and answer?
Well, just start by being mindful of your food choices. Kahit nutrition quality muna bago kayo mag-cut down on the amounts. So just remember that there are a lot of things that you can add to your diet para mas gumanda yung quality ng diet nyo. So just to recap, tip number 1 is about probiotics. Tip number 2 is about prebiotics, fiber-rich food items. Tip number 3 is about covering a lot of vitamins and minerals and phytonutrients in your diet. That's why variety is important. Isipin nyo na lang yung iba-iba dapat yung kinakain na plant-based food items at iba-iba rin yung kulay para mas simple. And then number 4 is about slow, mindful eating. And number 5 is about the things that you need to control in your diet. So, yun yung mga sweets, mga processed food items.
Processed food items. Nice. Thank you so much, Mabel. So, guys, we are going to go into our question and answer portion for those who are interested in exercise, warm up for arthritis. We can ask our friend Josh. And of course, for those who are interested on what foods they can eat or take to improve the quality of their inflammation para mawala sana yung inflammation sa joints for arthritis, we can ask Mabel. I think that, Josh, are you able to check the questions or chat?
Yeah, meron tayong mga questions here. So let me just pull up. I think I have at least parang may 5 na questions in advance. Or while we were Number 1. Okay. Ang sakit ng tuhod ko pag tumayo agad from sitting position. Any advice for this?
Yun. I think, anong advice mo, Josh? Baka gusto mong... Yeah, for you.
Sige, so feel ko, well, this is because of prolonged sitting. Diba? So marami sa atin, if we're not that mobile, excuse me, we'll just sit down a lot. So movement is medicine. I think that's a lot of people don't know that simple movements actually can improve your general well-being tulad ng mga exercises na na-demonstrate natin kanina.
Tama, no? So warming up the joints. Thank you so much, Josh. Tapos meron ding tanong for Mabel dito. So Mabel, they're asking about yung intermittent fasting po. May tulong po ba ito for arthritis? Yung mga, I don't know if this is a fad diet. would you say about these things?
Intermittent fasting can help in short-term weight loss, and weight loss can be beneficial for people who are overweight and obese na merong arthritis, any form of arthritis, but it's not for everyone. So it's not for people with diabetes mellitus and atherosclerotic cardiovascular conditions. And to begin with, bago kayo mag-isip mag-intermittent fasting, make sure na, let's go to the basics first, you have a regular eating schedule. You have at least a 12-hour window period ng pagkain. Ibig sabihin, if you start eating by 8 a.m., last meal of the day is by 8 p.m. So you maintain a normal physiologic overnight fast. So kahit yun lang muna, tapos gradually ninanarrow yung time of yung duration of eating for the whole day to help in weight management, and of course sa iba din na may problema sa blood sugar control, nakakatulong din yon. So yun muna, yung regularity ng eating schedule at saka yung pagiging consistent ng window period of eating. I think that's a lot safer generally for most people.
Thank you so much. So gawin niyo lang yung normal eating and physiologic fast, meaning kung kumakain kayo ng dinner at tapos nagbe-breakfast kayo, you can do that and you can just increase by maybe 1 hour, Mabel, no? Tapos, hindi masyadong maganda pag meron kayong diabetes mellitus, nag-i-insulin po kayo tapos nagpa-fast kayo. Mukhang di good idea yan for those who have atherosclerotic or problems sa heart and diabetes. So, please consult your doctor and nutritionist before you do this intermittent fasting for weight loss, because weight loss does truly help for arthritis patients. May tanong ulit for Josh, I think. So I think yung is yung balance, no? Yung you were talking about balance kanina, Josh. So wala po akong balance pag naglalakad, minsan parang matutumba. Meron po ba kayong advice para dito, Sir Josh?
Yes, so kanina, if you remember the thing we demonstrated during standing,
Yes.
Consideration dito yung weight-bearing status, no? Because not everyone are allowed to put weight on their legs. So please make sure that you get clearance first from your doctor. Kaya important din na nagko-consult tayo sa doctor kasi some people are not allowed to stand, with their full weight. Yung iba, they can do partial only. So the first step, I think, is to know what is your weight-bearing status. Your doctor can tell you. Second, start easily. So kung mahina yung balance, it's helpful to have some level of support. So for example, chair can be one. Kung kung something is stable, so a chair that's not moving, if you're going to do some balance exercises, pwede yun, or you can hold on to a wall, or you can hold on to a railing, or you can hold on to a table. Diba? Kasi not everyone has access to yung bars. Nakita niyo sa mga nagpapatherapy, yung mga bars and parallel bars. Correct. That's where we train balance. Pero not everyone has that at home, right? I'll be surprised kung meron yan sa bahay. So, find something stable and then do simple exercises that will train your legs. Some simple like shifting your weight from side to side.
Shifting one leg to the other.
Para masanay tayo na nagbibigay ng bigat from one side to the other. That's really the basic, most basic of all. Next, shifting forward and backward. And then you can convert. So, ganun lang. Pwedeng start yun. And then slowly, you decrease your support. So, pwedeng 1 arm mo lang. Pwedeng 1 arm mo lang. Ganun siya. So,
you're training.
Exactly.
Yes. Very nice, very nice. So everything is done gradually, one leg to the other, side to side, forward. Of course, dapat may stable na hinahawakan before sila bibitaw, no? Thanks so much, Josh, for that. So para sa mga walang mga balance, follow Josh at kakayanan.ph. He is actually sharing those exercises. He will post those later. Another question for Mabel, okay po ba yung keto diet for my arthritis? Yan, this is an interesting question. Maraming nagsasabi na nagkikito sila, nawawala daw yung joint pains. So, Mabel, what can you say about the keto diet for perhaps there are different forms of arthritis. Meron ka bang nakikitang improvements with this?
Well, just like intermittent fasting, it helps in short-term weight loss. But
Sure.
it's not for everyone with arthritis, lalong-lalo na yung may gouty arthritis, because high fat intake can prevent effective excretion of uric acid. So it tends to accumulate in the body with high fat intake. So, and make sure lang din that if ketogenic diet is really for you at cleared naman by the doctor, nutritionist, dietitian, make sure that you use the right types of fats or healthy sources of fats. So hindi lahat ng fats ay healthy. Importante
Tama.
to use the type of fats, plant-based oils na may anti-inflammatory properties. Meaning ito yung mga olive oil, pwedeng flaxseed oil, avocado oil, at hindi yung fats na galing sa butter, heavy creams, animal fats. So yun talaga kalaban natin, source ng saturated fats and cholesterol. So those are the type of fats na we shouldn't use even if ketogenic diet is really for us at pwedeng gamitin at a specific point in time.
So, babalik natin, very broad pala yung ketogenic diet. If you are thinking of doing ketogenic diet, it's not for everyone, just like yung intermittent fast is not for everyone. Sabi ni Ma'am Mabel, if you have gouty arthritis, it can worsen it. So be careful. Of course, maraming types of fats and oils, may good and bad. And you need to be careful, hindi masyadong animal saturated fats. Good fats and good oils from avocado, flaxseed, and coconut oil. Those are relatively better than the others. So be very careful. Consult ulit Mabel at Mabel Aban in Facebook and IG. You can reach her. And of course, your doctor if you are thinking of doing this keto or intermittent fast diet. Thanks so much, Mabel. I think we have time for a few more questions from Josh. Sabi Josh, may best time to do these exercises? Yung tinuro mo, Josh, when is the best time to do these exercises pala?
Generally, wala namang best time or ideal time per se. Pero, if it can facilitate adherence to exercise or regularity of exercise, it's best to do it first thing in the morning. Paggising pa lang natin. Why? Because we don't know what's going to happen for the rest of the day. Diba? So that 5 to 15 minutes of exercise, get it done. Tapos fresh ka pa from getting out of bed. Studies also show that your discs in your spine are more supple or parang more hydrated before or pagkagising sa umaga. So, while wala namang direct hard answer to that, it's recommended to work out first thing in the morning.
Okay. So, thanks so much, Josh. Recommended po ni Josh, first thing in the morning, pagising niyo po, you can do these slow exercises, no rush. Hindi natin alam anong mangyayari throughout the day. But I do note, Josh, personally, pag nag-exercise ako sa umaga, I feel a high. So may mga endorphins sa katawan. So hopefully that can help you guys. Choosing the best time is not a hard and fast rules. You can always exercise and warm up throughout the day. Tapos, another question for Mabel. Meron ka bang recommended na probiotic for arthritis, Mabel?
Yeah. I gave some examples na earlier, pero siguro it's good to also mention that supplements are available in case hindi makuha from natural food items talaga. Iba hindi kumakain ng yogurt or ayaw nila talaga ng anything na maasim. So consult your doctor, your nutritionist, dietitian for kung ano yung magandang supplement for you. But generally, pinipili din yung tinitingnan din yung content ng probiotics. Iba-iba ng dosages yan. Iba-iba yung strains ng microorganisms na nandyan. So, ang message ko lang dito, kailangan din ng guidance ng doctor, ng nutritionist, dietitian before taking any supplement.
Yes. So, for those of you, wag lang diretso. Don't just pick one antibiotic from the supermarket. I want you guys to consult a nutritionist, dietitian, or doctor like Mabel. Again, you can reach her at Mabel Aban, Facebook and IG. ask her about these prebiotics kasi merong iba't ibang, ano sabi niya, strain. I think strain means bacteria. So, iba't ibang klaseng bacteria na good for arthritis. You know, not all bacteria are good for arthritis. Meron good for the tiyan, you know, the gut. And of course, sabi din ni Mabel, may amount of good bacteria din. So, yung dami ng bacteria na nasa loob ng probiotic is also something she wants to talk to you about. So, thanks so much, Mabel. We have another question for Josh. And Josh, sabi niya na ano po ba yung I am planning to have surgery done. Meron po bang mga strengthening exercise? Yung mga tinuro mo ba ay pwede kong gawin in preparation or meron ka bang other specific exercises? Well, what can you say about that, Josh?
I think Miss Mabs emphasized a very important point a while ago na although there are things that we can do on our own, minsan, especially pag very crucial, we really need guidance ng professionals who assess us. No?
Yeah,
Usually, kasi if you think about it, I mean, it's fair naman. So, for example, people want to do things on their own kasi they want to save money or what. But if that's our mindset, imagine mo if you save money because you tried to do things on your own but you didn't get the results that you need, you will lose more. So, yun lang yung realistic na nakikita ko. Especially, I know we all have that, kailangan makatipid na, so just do everything. Pero, if we shift, that's one of my, something I'm advocating for na, think of it as an investment in your future na that's a short time in your life to hire a therapist or hire a nutritionist or engage their services. Kasi it's not forever naman eh. We're not going to actually, ang therapy, hindi yan forever. Only for a certain time that you need to make sure you'll be okay. So, that's my first recommendation. But if you want to do things on your own, pinaka-important yung ginawa natin kanina, yung muscle setting, you're pushing the pillow together. Because yung sensation that you feel inside your groin, that is strengthening your inner knee muscles that keep your knee stable. Right? Regardless
muscles, no? Wow. Thanks.
Any condition will benefit from that very simple exercise. The first thing. Tapos it's all about keeping your knee function there. Diba? Kahit ma-operahan ka, a lot of operations that I see, even if they have a successful surgery, if after, hindi mo inalagaan, sayang eh. Diba? Pag hindi na matutulungan to function properly or to use the new device properly, it's either they don't get the benefit from that or the other knee or the other hip follows. So, kailangan talaga ng guidance that's really without any biases. We really need to get guidance from licensed professionals. But again, for those who cannot, simple exercises. Balik lang kayo dun sa mga tinuro natin.
Yes. So I think that is all the time we have for today. I want you to realize na if nagpapa-opera po kayo and you want a successful surgery, doing a proper diet and exercise, you would want to also spend a little fraction of that. Kasi ang mahal ng opera, consultation with a nutritionist, dietitian, and a physical therapist, wala yan sa opera na price. I want you to I think, Josh, you can share with us how you can get consultations from Josh, get consultations from Adele. And thank you so much for your time, guys. I really enjoyed this session. I hope nakatulong po ito sa mga arthritis warriors natin. How can they contact you again, Mabel and Josh? We have some slides to share with you just before we end.
Just 1 second. So I'm just gonna pull it up. Pero for us, for physical therapy, please follow Kakayanan Physical Therapy page here. We're also on Instagram, Kakayanan. Stands for ability. So, madali lang siya maalala, no? Because physical therapy is about getting you to your maximum movement potential. Right. Yes. Now, for Miss Mabel naman, you can reach her on Bel Aban.
Ayan, at Mabel Aban for both Facebook and Instagram, or also you can also reach out to me through at Shape Clinic PH. The
Shape
website
Clinic.
is shapeclinic.ph. Thank you.
And you can reach me at, what is it? Dr. Joff Hip and Knee Arthritis at Facebook.
Dr. Joe, Facebook. Dr.
Yeah.
Joe, Hip and Knee Arthritis, correct?
Yeah. So thank you so much, guys. We'll have a little pictorial before we go. Picture muna tayo to document this wonderful session. I hope to have another session with these wonderful people in the future. Heart sign na ako ulit. Have a great day, guys, and mga Arthritis Warriors, I hope to see you soon. Bye-bye.
Maraming salamat. Dagang salamat sa Thank you so much. See you next time.
Thank you. Stay healthy, everyone.